So my name's Alyson Clark, as Lynn said, and this is my presentation on my BA practicum experience at the Island Community Mental Health Association here in Victoria, BC. So Island Community Mental Health is a nonprofit organization that provides programs and services to individuals recovering from and living with mental health and substance issues. The aim of these programs is to promote inclusion and enhance and enrich the lives of its participants. The Circles of Support project is a collaborative project between 6 partner organizations and is funded through a grant received from the Community Action Initiative. The project itself centers on strengthening the social networks of informal caregivers, specifically those caring for people living with dementia, through revitalizing relationships, creating connections, and establishing community support that enhance and relieves those coming from the more formal services. So my practicum experience focused on assisting the project coordinator of the Circles of Support project, and this involved a variety of tasks and duties, such as participating in partner meetings and training events, co-facilitating caregiver support circles, grant reporting, administering participant surveys, and developing an online community practice. So one of the 5 key components of this project involved developing a community of practice to support the newly trained staff and or health service providers to integrate the Circles of Support model into care or into practice. And the focus of this was to provide an accessible forum for sharing experience, knowledge across multidisciplinary teams, and to recruit and train facilitators to adopt the new model of care, all of which helped to support the necessary system shift to begin supporting informal caregivers in a more meaningful and sustainable way. So based on an end goal of making this model accessible to health service providers across the province of BC, an online learning environment was created as the training and continued support for integration of the new model of care lends well to this format. So the development process involved researching to learn more about designing and cultivating communities of practice, collaborating with newly trained health service providers to gain a better understanding of the variety of needs for integration, to determine the key components required for accessible, effective, and sustainable multidisciplinary communities. Based on this, components such as a resource section, blog, and toolkit were all included, as each supports the sharing of knowledge and experience through an accessible and collaborative format that is scalable to expand across the province. So there were a number of skills and knowledge that I learned through the Health and Community Services program that were drawn upon during the development of the online community of practice. For example, the resource section provides access to evidence-based research that it indicates the increasing strain on the informal caregiving population and the need for additional support, along with guidelines and frameworks that encourage future research, debate, and discussion on the topic. This not only supports the development of a knowledge base to guide evidence and practice-based decision-making, but also the synthesis, exchanging, dissemination, and transferring of knowledge across disciplines and areas of practice. Based on the collaborative nature of the Circles of Support project, open and respectful lines of communication were established early on to ensure trust and mutual understanding were the guiding factors in interpersonal communication and teamwork. So in terms of the public health and social policy values, and based on the project involving 6 partner organizations, the diversity of skill and knowledge of the health service providers involved, and the need for systemic shift, and the necessity for additional resources, the values of partnerships, multidisciplinary approaches, critical analysis, and engagement for social change, guided various aspects of the project. By not instilling these values, challenges associated with interpersonal team development and communication would likely have occurred, thus impacting the supportive nature necessary for sharing experience and knowledge in an online forum, and impeding optimal health outcomes for the currently underserved population of informal caregivers. So at this time, I'd just like to say thank you to my practicum supervisor and Island Community Mental Health, as well as the faculty and staff of the program, and most definitely to all of my classmates. Thank you.
See, Alyson has posed a question for us. Who wants to take a stab at answering that?
If no one else has any questions, does anybody else have examples of a working community of practice related to either your practicum experience or just your work experience?
Kathy, sorry, I didn't see you.
No, I was late. Slow on the trigger. At the ministry, and I think a couple of people who worked in the Ministry of Health, we do have a policy community of practice, and they're responsible for meetings on a regular basis, and they think about topics of the month, whether it be introducing new policy, tabling to Treasury Board submissions or whatnot, but it's it's topical, but it depends on whatever comes up. And then also they integrate research initiatives into there and to determine how that would influence the way that we practice our policy and the work that we undertake daily. So it's online. Everybody, you can stream in, people sign up, obviously as policy analysts, but it influences everybody's work and it allows you to continue your growth as a professional without having to move on and constantly compete for those positions, but you can network within the practice community.
With my position with First Nations Health Authority as regional project developer for Vancouver Island region, and the other regions within BC also had a regional project developer. So the 5 of us worked in a community of practice just to share best practices and to bounce ideas off each other and to gain whatever we needed from each other. It's a way of sharing.
Great examples. Thank you. Kathy, did you still want to?
Maybe what would be helpful for the rest of the group is, can you briefly describe what your community of practice looked like, and what is a community of practice anyway?
Yeah, so for the Circles of Support project, they were focusing on health service providers that are connected to caregivers for those living with dementia to increase some of the supportive services, but in a more informal setting. And it's sort of a new model of care that was being adopted or trained and then hopefully adopted and integrated to multiple areas of practice. So there is a real challenge in sort of building a community that will be able to grow and adapt and expand to reach a large portion of the population that they're trying to serve, but taking into consideration that everyone has different settings and work requirements and goals and roles and responsibilities and so on and so on. So trying to build a central location that people can collaborate together and try to sort of work through a new approach to care.
Okay, lovely. Thank you, Alyson, and thank you, everyone.